A hospital surgical technician who's been indicted for allegedly stealing prescription drug fentanyl from hospitals across 4 states of the US for years by swapping syringes of the addictive painkiller for his own saline solution syringes. He's now also been confirmed as HIV positive, and he may well have put over 6,000 patients at risk of contracting the deadly virus through his swapped syringes. Well, it's another case of fentanyl addiction, this highly addictive drug that we're hearing so much about in the media at the moment. It seems like it's the year of fentanyl at the moment, causing another array of problems. This man, his name is Rocky Allen. He was actually in the US Navy. He was discharged. He was court-martialed and discharged from the US Navy for stealing fentanyl from a hospital in Kandahar, Afghanistan, back in 2011. He said he initially got his addiction to fentanyl because he was using it. It is a painkiller. He was using it to get over some of the trauma that he was witness to, the bloodshed out there in Afghanistan. At the time, he spoke out, he said, "I've learned so much from this experience. I know that it's made me stronger." Well, clearly not, because he started working in various hospitals around the US. Swedish Medical Center in Englewood, Colorado is one that's under a heavy investigation right now. He worked there this year, August to last year to January of this year. He's previously worked in hospitals in Seattle, in other states, and we're now looking at the fact that over 6,000 patients are having to be tested for HIV because he swapped fentanyl-filled syringes for his own saline syringes. And the fact that he has HIV himself probably means he's someone who shares needles.
Right, he wasn't cleaning those needles or before putting them back properly. We're talking about a man with a documented history of addiction, a documented history of being unfavorably discharged because of this addiction, and yet that was missed. He was constantly rehired, Joe, in this process, which is the most remarkable part of the story for me. Highly addictive substances, we know it's been in the news lately because of Prince and his death. It was reported that that substance was affiliated or a part of his death, that he had OD'd in fact. 30 people have lethally taken a dose of this in Northern California this year alone. So we're talking about a massive problem here, but the bottom line is, these patients that he put at risk for HIV, number one, and number two, what type of culpability or liability does this hospital that he worked for have, where the exposure aspect, because they didn't do their due diligence and properly check up on his history?
Absolutely. Well, it seems that there is a problem in terms of a lack of a central tracking system for hospital technicians who do have the access to drugs. And it's not the first time, it's not even the second time, unfortunately, that this has happened, and it's happened before with hospital surgical technicians who have addictions to fentanyl. In particular, back in 2013, David Kwiatkowski, he was sentenced to 39 years in prison for stealing syringes of fentanyl. He was at the New Hampshire's Exeter Hospital, and he had hepatitis C and managed to pass his hepatitis C on to other victims. It's happened before. It may well happen again. We're seeing this drug hitting major media, obviously this week, because of Prince found to have OD'd as well. So this drug is coming into the light more and more this year. We're hearing that it's 100 times more powerful than morphine. It's 25 to 40 times more powerful than heroin. You can also, in a way, there is some sympathy for these people, because obviously once they get into this cycle of addiction, it's clearly so almost impossible to get out of. This man, though, and this speaks to the larger problem, was hopping from hospital to hospital. They weren't checking his records. They weren't properly checking whether his resume was accurate. We know that he was fired from Banner Thunder Medical Center in Glendale for stealing drugs. We know that he was fired from John Lincoln Medical Center in Phoenix after being found unconscious in the bathroom with an empty syringe and testing positive for fentanyl. So this is something that the hospital system here in the US is going to have to clear up.
I agree. The potency of that drug, it's hard to get the dosage correct, because we know that it's very potent, and that's why we're seeing people OD on it, much more potent than opioids or heroin. It's a very dangerous substance.
Well, Rocky Allen is the name that he is going by. He's been indicted on charges of tampering with a consumer product and obtaining a controlled substance by deceit. The larger problem, though, is that around 6,000 patients across the US are being tested for HIV because he swapped his own saline solutions for those filled with fentanyl at the hospitals he was working at.